Hello, my name is Abdul Khan. I'm a fourth-year diagnostic radiology resident in ESIR at the University of Arizona. Today I will be discussing my research study titled Single Center 5-Year Analysis of Survival and Quality of Life of Catheter-Directed Therapy of Submassive Pulmonary Embolism. Pulmonary embolism, or blood clots to the lungs, are a significant cause of mortality in the world. The reported mortality of a submassive or intermediate risk PE is 22%. For those that do not die, there are risks related to right ventricular dysfunction, myocardial necrosis, development of chronic pulmonary hypertension, all leading to decreased quality of life and functionality. There have been technological advancements in catheters that have allowed the production of devices to treat pulmonary embolism. Guidelines regarding the appropriate use of these devices in the optimal clinical setting have yet to be established. Although many studies have shown devices to be safe and effective, the long-term data regarding PE catheter treatments is minimal. This is further propagated by CHEST guidelines detailing low quality of evidence for the use of catheter-directed therapy. The treatment for intermediate risk PE by catheter-directed therapy requires long-term analysis of quality of life, functional status, and survival analysis. The purposes of this study was to analyze outcomes of catheter therapy regarding long-term survival and quality of life with comparison to a matched cohort of patients treated only with anticoagulation. This study was a retrospective study that investigated patient outcomes of catheter therapy for intermediate risk PE and compared that to patients treated with only anticoagulation. A total of 27 patients that were treated with catheter-directed therapy were followed over the course of 5 years, as well as a total of 35 patients who were only treated with anticoagulation. This data was used to perform survival analysis with the creation of a Kaplan-Meier curve. Additionally, a small set of these patients were brought back to clinic and completed a quality of life survey standardized to PE called the PE or PEM-Q quality of life survey, and they also performed a 6-minute walk test. The catheter-directed therapy survival probability decreased to 63% over the course of 5 years. And while the survival of those treated with only anticoagulation decreased to 51%, this was not found to be statistically significant, with a survival probability of p-value equals 0.7. When we performed our 6-minute walk test, we noted that there was a difference in distance traveled, 394 meters traveled by those treated with catheter therapy, whereas there was 374 meters traveled by those treated with anticoagulation. However, this was not statistically significant, with a p-value equal to 0.3. When we did our quality of life analysis, we used this survey comparing the results of those patients treated with catheter therapy against those treated with anticoagulation. We noted significant differences in the subscales of quality of life relating to activities of daily living and emotional complaints. These had a p-value less than 0.05. Overall, this is a small retrospective study showing some promising data of differences between quality of life. As the power of this study increases and we recruit a few more of those patients that were lost to follow-up, there's a possibility that the functionality aspect, the 6-minute walk test, will show a significant difference. As prospective randomized control trials continue to spawn, evaluating new catheters for PE treatments, this data should influence the study of long-term outcomes, specifically with regards to quality of life and functionality.